From the 12th of March, Victorians will be able to create an advanced care directive, giving people the opportunity to express their values, beliefs and preferences about healthcare and medical treatment.
Once that document is signed by the general practitioner and the patient, that document becomes a legal entity, so that at a time in the future when that patient's unable to communicate their wishes for their medical decision making, the treating team will execute their wishes. Universally, I've found that having the discussion with patients has been very positive. The first step is obviously bringing up the topic and providing information, and then patients take that information away and start to consider the things that they want to include in the plan.
This is really for any age group. No one knows when you might need an advanced care plan. It's not just about the dying and their end of life, but really their healthcare wishes from here on.
We had a patient in ICU who said that nobody had ever talked to them about this before, even though they'd been living with a life-limiting illness for some time.
I think the booklet's really excellent to give an organisation a real framework to work on. It's quite systematic. It goes through looking at best practice and making sure that what we're embedding is evidence-based and best practice, and then it really goes on to guidelines around how to educate both staff and clients.
The guide simplifies the process and breaks it down into simple steps and uses a checklist that's easy to follow. Taking that approach is going to make a process that previously has seemed quite daunting and onerous into the simple process that it actually is once you start doing that in practice.
I'm already promoting it, sending it far and wide and saying, these are the things that we need to be thinking about. When somebody arrives, asking them if they've done any advanced care planning, and if they have, making sure that a copy goes into their medical record and an alert gets created in our patient management system. And if they don't know what you're talking about, then it's an opportunity to educate them and give them a brief overview of what it means and give them a brochure and tell them where they can find out more information if they want it.
I think it's everybody's business. Advanced care planning conversations should be ongoing. They're not just a one-off conversation. They're something that all health professionals can assist with, and in time leading the clients to encourage them to talk to their GP.
I hope that translates into more advanced care plans being written for patients.